Is the COVID-19 pandemic actually over? President Joe Biden said in a 60 Minutes interview this weekend that it was, but acknowledged the virus itself is still an issue. The president's remarks were apparently off the cuff, with two anonymous senior health leaders telling the Washington Post that the administration was surprised he said that. Right now, the U.S. averages more than 460 COVID-19 deaths each day. That's according to New York Times data. So what's going on? Is it over? Our 9 health expert, Dr. Payal Kohli, joins us now to talk about that. Thanks for coming in.
Good morning, Gary.
So the president said that no one is wearing masks, and that's one reason we should consider it over. Is that something that you consider?
I think the president's logic here is completely reversed. It's sort of like saying, well, everyone is smoking, so it can't be bad for you. Or everybody's overweight, so we don't have an obesity epidemic. And you know, a plane full of Americans is still dying every single day. The behavior to not wear a mask was driven by personal preferences, by the CDC's guidance, partly because they wanted people to return back to their lives, help the economy to come back to normal.
Right.
But it was not necessarily driven by whether the pandemic is over or not.
So where are we with COVID infections today, say, compared to, a year or even a year or two ago?
We're in a much better place. So I want to be optimistic because we are way better than we were in January of this year. A couple of years ago, you remember what our lives were like. But despite having said that, we are still seeing infections go up, not down. So Japan, for example, in the last month had a 29% increase in their infections. Taiwan and Hong Kong had a nearly 20% increase. And here in the United States, we're recording a 3% increase, knowing that at this point, most of us are testing at home and may not actually be reporting those positive infections to our local public health department.
So the president also indicated that he believes, and some health experts have even said, that we're entering the endemic stage of this rather than the pandemic. I don't think people really know the difference between those two.
Yeah.
So what's that all about?
So two things to think about. How quickly is the disease spreading and how much of an area does it affect? So a pandemic means that it's spreading very quickly in a large geographical area. Endemic means that the rate of spread is predictable in a smaller geographical area. So I think for the last few months, we've sort of been flirting with the endemic piece of it because our infections have started to level off, again, with the caveats that we may be undercounting the cases. But the fact that it's still growing worldwide, I think it makes the president's statement that the pandemic is over, which affects the entire world, a little bit premature and not really based in science.
Can you go back and forth from an endemic to a pandemic? I mean, because this winter they're expecting more cases.
You absolutely can. And that's the key of it, too. You can't just say, oh, the pandemic is over and now we're endemic. And it's a one-way sort of thing. It's bi-directional. So at any given day, we could be in more of an endemic phase, or we could be in more of a pandemic phase. And we, as citizens and people, have to really learn to be flexible with our behaviors as we go back and forth to really try to push it to stay in the endemic phase.
And now the big deal, of course, is the new vaccine, the booster that takes care of supposedly Delta and the original.
Yeah.
Is that a game changer? Will that make the pandemic eventually go away?
I hope so. I really, really hope so, because I'm very excited about the data. I've looked at both the longevity of the response as well as the intensity of the antibodies that it makes. And I think if we really do a good job of getting our boosters, we are priming ourselves for this winter to start to shift to endemic and continue to enjoy the indoor activities and the things that we've been doing.
Very good. I got my appointment for this afternoon.
Excellent.
See?
I was about to ask you.
I have the sore arm tomorrow. All right. Thank you very much for coming in. Appreciate it. Ed?